Hello, everyone, and I'm super excited of being here today sharing with you this presentation about how to close the gap between physicians and healthcare innovation. Let me introduce myself. My name is Miguel Villara. I'm a certified physician life coach. I'm also a positive intelligence coach, and I offer coaching services to physicians and healthcare workers and entrepreneurs that are interested in changing their lives, improving their mindset, and reach their goals. Over the course of my career as a mentor, as a coach, in a formal way for the past couple of years and informal for at least now 5 years, I've been able to work and interact and empower multiple physicians to get into not only change their life or their career, some of them transition into new endeavors, but also a lot of them interested in building their own businesses and some of them getting into the healthcare innovation space. Now, why this talk is important? I truly believe that even though there is a huge movement around healthcare innovation, there's still a quite gap between physician engagement and involvement in all these new ideas that are on the works. There are multiple reasons for that. We're going to explore it. But at the same time, I think that this is a moment to build this momentum where we can all together work to build more physician engagements and getting them into healthcare innovation. Let's start answering. Some of them might sound like an obvious question, but it's relevant. Why we need physician involvement in healthcare innovation? Well, first and foremost, as a frontline provider, I still practice hospital medicine. We're the ones directly taking care of the patient. Therefore, our input is invaluable for any opportunity for innovation. We have the clinical expertise to come up with effective solutions that might help and ensure any healthcare startups or any ideas that are clinically relevant and beneficial for our patient. There is a component of quality and safety oversight. We were sharing yesterday one of the main concerns about privacy of the EMR, of the records, of the patient information. And the reality is that we went through all this painful process of getting trained about HIPAA compliance and privacy and so on. I think that we're in a really good position to be a good steward of the patient information as we are the ones taking care of them and accessing all this technology. Now, I'm an advocate for patient-centric innovation. And over the past year, I have multiple phone calls for different healthcare startups, some of them looking for investors, some of them looking for advisors. I've been able to connect a lot of them with physicians that are interested in getting into this space. But one of the first questions I always make, what is in for the patient? Because the reality is that we're advocating for patients and we're looking at solutions that improve the relationship patient-provider, make us more efficient. I truly believe through innovation is where we can tackle burnout. Now, why physicians are not getting involved as much as we hope or as much as we want and as much as we need? I want to give you an example. I recently was having a huge opportunity to coach in one of the largest healthcare-related entrepreneur conference. It was in LA. There was around 850 attendees, among most of them physicians, some others were physician assistant or healthcare or advanced nurse practitioner. There was emphasis about entrepreneurship in general, real estate investment, and so on. 850 sounds amazing, but the truth of the matter is that there are at least 1 million of physicians in the United States. So this is still a minimal, minuscule amount of people that is getting engaged or involved in this movement. One of the missions of my company at the Doctor's Journey is to empower physicians and try to connect them and close this gap that we definitely need to close. There are multiple barriers for it, and this is not a matter of putting excuses, but the reality is there are time constraints and workflow. Our healthcare system is very inefficient. There are so many gaps on the care of the patient, so many steps and processes. And this is precisely why we need innovation to make things more faster and more efficient. We have more time to allocate some of our time into other projects. There are administrative burdens, documentation, regulatory compliance, that definitely affects engagement. Physicians in general, we are very risk averse. And to some extent, I am risk averse, but I try to make educated decisions to where can I invest my money, who I can work with, and so on and so forth. I'm very selective with my connection. But the point in case here is that As I coach more and more physicians, I come to realize that this phenomenon of risk aversion is stopping a lot of physicians from taking that leap of trying to build something new based upon what they feel and think needs to change. And that's the part where having a lack of formal training and trying to close the knowledge gap some of us have about the business aspect, how to build a company and so on is necessary. That's what I love to be here presenting, because venues like these, events like these are the ones that will give us that opportunity to close this gap and be the push that some physician needs to jump into the healthcare innovation space. Unfortunately, I work one-to-one with physicians. I focus on them, but there are institutional barriers that goes beyond physicians. Nowadays, there are so many less physician-owned private practices and more larger healthcare system-driven practices, not only clinic, but also hospitals. I'm going to give you an example of how these barriers works. I'm currently an advisor of new healthcare startups that is deploying artificial intelligence into the revenue cycle process, improving documentation and expediting also the billing process. I'm very excited and I like this product as I have tried myself. So I've been making a few introductions with different hospitals, clinic, and healthcare system. And guess what? The common pattern I have seen is that small private practices owned by physicians are the ones that are being more keen or even given an opportunity to this type of new technology. And by the way, they're reaping up the benefits from it. But on the flip side, a lot of the introduction I have to more of the larger healthcare system in Northern Nevada has been very resistant and reluctant to even consider any of these new innovations to be deployed into the processes. That affects also our physicians, because some of these healthcare systems, which I work with, some of the physicians, I know they're struggling with a lot of burnout. The common thing is lack of autonomy and excessive documentation time. And yet they are not embracing any potential solution. Physicians, we also are very rooted into our income, right? We're high earners, but not rich yet. So we're so core into our W-2 incomes, and therefore that becomes a barrier, some of them, due to the fact that there's a lot of uncertainty when we're going to get into the healthcare innovation state. And we know that there's a lot of risk involved. But going back to the individual, there's a lot of emotional and mental strain. And part of it is burnout and the moral injury that a lot of physicians are suffering from. Nearly 30-40% of physicians are planning on going part-time over the next 3 years. 2 in 3 physicians are burned out. 3 in 4 nurses are burned out. So if those stats are not eye-opening, definitely I know what else can raise your attention. Once again, there is a financial resources constraint, and we need more programs, mentorship, and not working. And I truly believe in the power of leverage networking, and that's what I'm here presenting in this event. So this is going to be more a call for physician-driven model for innovation, where physicians are getting more involved into the entrepreneurial perspective. I'm part of different communities that I'm so glad to set and share that there is a rising interest for physicians to get involved. But I think there's still a huge gap from a lot of the ideas that are deploying out there and the healthcare providers that are at the front side, at the bedside. And that's one of the things that I'm very passionate to work towards, because I think the physicians can identify market opportunities if they're in the right mindset, from a grow mindset mentality instead of a scarcity mentality and victimhood. They can definitely build credible startups, and with the right mentorship and leadership, they can be successful in the process. So what can we do to close this gap? What strategies we have for engagement? And the most important message I want here today is being described by Brené Brown as disruptive engagement. What we need is to reignite creativity, innovation, and learning, and humanize education, but also work environment. Because so far, the way I see it, a lot of physicians are struggling with burnout. Some of them are looking into career transition. Few of them get into entrepreneurship, either real estate, building their own businesses. Some of them will get into healthcare innovation. But I can tell you, the ones I know that are getting into the healthcare innovation space are trying precisely to use all these inefficiency projects, programs, and products that can tackle burnout and the lack of an efficiency. This become an interesting cycle where I truly believe through healthcare innovation is where we can tackle physician burnout. We need more education and awareness program, building a supportive ecosystem. I love these venues, the innovation hubs that can plant the seed of these ideas to help them grow into beautiful trees. This is when it becomes a little more challenging. We truly need policy and organizational change. The other side of the coin about my mission is also to empower physicians not only to get into entrepreneurship, but get into executive and leadership position within an organization so we have more leverage in the decision, because the only way to change policies are if we have physicians sitting on the table. And I'm going to share in the future, as I'm part of the Innovator MD, we have collaborated before, what my experience is going to be with these opportunities that I'm trying to seed into this healthcare system in Nevada and see how we can get to them to embrace the possibility of deploy some of this new technology into the work. We need to address mental and mindset barriers. And for that, I strongly believe in coaching. I am a life coach, positive intelligent coach. I offer strategic coaching to physicians, entrepreneurs alike in general. I think anyone could benefit from coaching. And going back to the point of burnout, there are good data showing that entrepreneurs in general, not only physicians, are also struggling with a high rate of burnout. Therefore, working towards getting a good coaching program, a good coach can be extremely powerful. I'm currently working on a mastermind with a few other coaches, and we're going to start help physicians that are interested to get into the entrepreneurship space, workshops, and many other programs. We need to leverage technology, specifically digital health. This is going to be my very straightforward physician to healthcare innovator playbook. We need to cultivate an innovative mindset. Physicians that are coming from a place of a growth mentality, from a place of resilient, anti-fragility, empowerment. Those are the ones that will build and shape the future of the healthcare system through innovation. Those that are struggling with victimhood, struggling with burnout, with resentment and so on, those definitely, most likely, it's not gonna work. We need to close this knowledge gap again. Events like these are extremely useful and empowering. Identifying opportunities for innovation, developing the innovation. Of course, this is the part where sometimes you need to deal into partnership, things like that. How you can get the help to navigate the business aspect of it, how to make a successful launch and scaling and continue improving. I truly believe that in the confluence of medicine and innovation lies the future of healthcare, and physicians are part of the architects of this future. That's why I am launching a podcast that is coming in the next few weeks calling Medicine with Coaching and Healthcare Innovation. It's going to be a lot of strategic coaching for physicians and physician entrepreneurs and entrepreneurs in general. But I'm going to be also bringing a lot of new healthcare innovative companies that are willing to connect with physicians and see how they can work together, either continue improving or building all these new products. I'm super excited about it. I'm just taking that opportunity to share it with you guys. Thank you very much.